একসময় ভাবা হতো রোবোটিক সার্জারি শুধুই বড়দের জন্য, অ্যাডাল্টদের জন্য, কিন্তু আজ এমনও হচ্ছে মাত্র 50 দিনের ছোট্ট শিশু তারও কিন্তু রোবোটিক সার্জারি হচ্ছে, সারানো হচ্ছে ইউরোলজি জটিল সমস্যা। প্রযুক্তি কি সত্যিই শিশুদের সার্জারির সংজ্ঞা বদলে দেবে? আজ দ্য ওয়ার্ল্ড আরোগ্যর বিশেষ আলোচনায় সেই কথাই শুনবো। আমাদের সঙ্গে রয়েছেন অ্যাপোলো চিলড্রেন্স হসপিটালসের সেন্টার অফ এক্সেলেন্স পেডিয়াট্রিক রোবোটিক ইউরোলজির অন্যতম পথপ্রদর্শক সিনিয়র কনসালটেন্ট ডক্টর ভি শ্রীপতির কাছে। ওয়েলকাম ডক্টর।
Thank you.
Welcome to the World Arogya. Sir, pehli I will question that robotic surgery is a quite serious term, and we think about adults and like that, or young person. But today, आज जो अभी अभी जो जन्म लिया है, ऐसा छोटे छोटे बच्चे को भी रोबोटिक सर्जरी हो रहा है, और स्पेशली जो यूरोलॉजी है इसमें एक बहुत बड़ा चेंज आ गया है। तो इतना बड़ा चेंज ये जो टेक्नोलॉजी के साथ, इसको आपको कैसे देखते हैं?
So, to answer your question, the reason why robotic surgery became popular in children is because when you use the robo, it's actually, when you say robotic surgery, it is not the machine that is doing the surgery. The robo is only an instrument between the surgeon and the child. And it basically helps to do laparoscopic surgery much better. I will explain in a way that everyone can appreciate. Suppose you put your head, you're in a swimming pool, and you put your head underwater with the goggles, and then you can see. Suppose you're out in the sea and you're able to see the coral, you're able to see the fish, you're able to see different colors, you're able to see in 3-dimensional depth. Robotic surgery is something like that. When you put your head inside the robotic console, you are completely shut off from the outside world, and with full concentration you're looking inside the child's abdomen, and there you have 10 times everything is magnified. Let us the kidney is 5 centimeters, it will appear as if it is 15 centimeters. So you can go and do whatever you want just there, not disturb anything else, and come out. The second thing about robotic surgery is, unlike laparoscopic surgery, where the instruments are straight and stiff, in robotic surgery, the instrument tip is like the hand. It can bend, it can bend, it can...
And it moves like 360-degree, full rotation.
So that way for children, since you asked me the question, in children it is particularly helpful because a tiny baby in a very small space, suppose I have to do cutting and stitching, I just have to move the instruments a little bit and my job is done.
Right.
So not much disturbance, great magnification, full depth, and I'm able to do it with concentration, with just the minimal dissection and disturbance as required.
And flawless outcome.
Absolutely, absolutely. We looked at our results, and we have 98.4% success.
Right. Sir, अपोलो चिल्ड्रंस हॉस्पिटल का जो ये जो सेंटर ऑफ एक्सेलेंस है, तो यहाँ पे अभी तक मैं देख रही थी कि 400 से भी ज्यादा रोबोटिक सर्जरी हो गया है, और सबसे यंग पेशेंट जो था वो 50 डेज का है।
Correct.
50 डेज का था, तो हम सोच भी नहीं सकते जिसका 2 महीने भी नहीं हुआ। तो एज अ पेरेंट्स ऑलवेज देयर इज अ कंसर्न, लाइक इतना छोटा बच्चा इतना बड़ा सर्जरी सह पाएगा, क्या होगा? क्या ये कंप्लीटली सेफ है फॉर इतना छोटा बच्चे के लिए भी?
Absolutely, absolutely. In fact, the smaller babies respond much better.
Okay.
But the thing is, I take it. I take your question very seriously. The parents are concerned about the safety of the child. That's why when we started our program in the year 2012, for the first about 100 cases, we concentrated only on older children. Once we became completely confident about the machine, our ability to manipulate the machine, the hands, everything, our ability to do the surgery in a very minimal disturbance manner, then we went, after 100 cases, we went below 5 years of age. After about 150 or 200, then we went below 1 year.
Okay.
So when exploring 1 year, what we have discovered is up to 6 kgs or even 5 kgs, you can do very comfortable.
Okay.
The smallest baby we have done is 3.5, but I must tell you, at 3.5, there is not much space to do whatever you have to do. But one thing I can assure you, 100% safe. No doubt about it at all.
So the surgery is safe and flawless. What about the recovery? Because children are very playful and joyful. They will not sit or they will not like lie down. चुपचाप सा तो नहीं रहेगा.
Yes.
तो इसका जो रिकवर ये भी बहुत फास्ट होता है. तो ये जो चेंज है कितना जल्दी वो नॉर्मल लाइफ में आ जाता है.
So I'll give you the timeline for our procedures. We usually start a robotic surgery at about 6 in the morning. Let us say we finish by about 9 or 9:30. By 11:30, maximum 12, the child is ready to take water. Once they take water, then they go on to having juice and liquids. By the evening, they start eating. And by that night or early next morning, they're generally walking and they're ready to go.
Okay.
What happens is the parents generally they have taken leave, especially parents from West Bengal who come there who want to take, to sort of, have a short holiday. They tell us we like to relax for 2 days before we go back. So otherwise the child is ready for discharge the next day. Generally.
Okay. ये एक दिन का मामला है बस.
Yes.
Right.
Absolutely.
Right. So for layman, there's the word robot. They sometimes think that the baby will lie down and one robot will come with some scissors and sharp knives. What if the robot does mistake? What if the robot battery ends? Like this type of questions. But
So-
the surgery is done by only the surgeon.
The surgeon is the only person who does the surgery. The surgeon is completely in charge of the instruments. The robo is extremely safe. There are so many built-in safeguards within the robo. There is no question of any failure. I mean, I can tell you in Apollo Hospital where we have the robo where we are doing the procedure, we have crossed about 7,500 or 8,000 surgeries and not a single problem with any.
Right.
There will be problems. I'm not saying there will not be problems. Occasionally the camera will fail, which happened in one case, but we have a backup.
Right.
But there is no way that it will completely, create a situation where the robo will go berserk. That's what we see when we see robotics, no? We see robotics, we see robos running, and suddenly they go mad, and they go this side, that side. No, those are autonomous robos. These are not autonomous robos. They cannot do anything on their own. We control it. Whatever way we move the instrument, that is the way the robo moves. Otherwise, the robo will not move on its own.
Yes, right.
So it's 100% safe. No problem at all.
So robotics is like अभी एक बहुत बड़ा चेंज हो गया है. अभी तो AI भी आ गया और भी प्रिसिशन बढ़ रहा है. मतलब एडवांसमेंट का कोई एंड तो नहीं है. हम आगे ही बढ़ते जाएंगे. तो सर आपका जो इतना लॉन्ग करियर है, आप इतना पहले से इतना ओपन सर्जरी से शुरू किया, अभी आप 3-3.5 किलो का बच्चे का रोबोटिक सर्जरी भी कर रहे हो. तो ये जो जर्नी है अगले 10 साल में हम अगर आगे देखें तो आगे सोचे तो आप कहाँ पे देखते हो ये सर्जरी को?
So some of the things that I can see are very major procedures will be easily done robotically. So we have a condition called neurogenic bladder where the children are born with a spinal abnormality called myelomeningocele. They can't pass urine. The bladder pressures are very high. So what we do is we open the bladder, that's called augmentation, and we put a patch of bowel on that. That's a major surgery. That usually takes, by open surgery, it takes about 5 hours to 6 hours. If you do it robotically, then you have multiple small holes and you can do the procedure very easily. To do this, what happened was, when I started my robotic training in 2012, I was not equipped to do that. In 2023, I went back to Chicago, sat again on the live pig model, used a pig, did the procedure, convinced myself that this could be done well, and now I'm ready to do it in a child. In the same way, we have tumors like what are called rhabdomyosarcoma, which is a very bad tumor which affects the bladder, in which you have to take out the bladder. Or you have a condition called Wilms tumor, which affects the kidney, which you have to take out. Or a condition called neuroblastoma, where extensive surgery. For all this, the greatest advancement I can see is, normally what you do is you do CT scan, MRI scan, you see it on the X-ray lobby, then you remember it in your head, and then you sit there and then you do the procedure. Today, the advancement is, since you mentioned AI, what AI will do is it will get those pictures and overlay it in front of me over whatever I'm trying to see. For instance, if you think of the kidney like this, and the kidney vessels are coming like this, and there is a tumor here, and I'm cutting from the top, I don't know at what depth the vessel will come. The AI will tell me, because it will put the CT scan in 3-dimensional on me, and as I'm going down, it will warn me saying the vessel is coming, be careful.
Right.
So that is the sort of advance that we are looking at. And this is only one aspect. There are so many things that are going to come. Once AI is integrated with robotics, which it already is, you will find that there will be tremendous advancements. So what AI can do is, suppose you are seeing a very difficult situation. Sometimes we see two kidneys joined to one. And one part is diseased, that has to be removed. So the AI will tell me exactly which is the best way to go. And it will warn me saying at this level, this will come, be careful. And it will tell me behind this will come. It will tell some abnormal vessel is coming from the back. It will tell me one important nerve is coming. All that AI will do. So surgery will become much more safer in 5 to 10 years. I feel after some time, I mean, this is my estimate, after some time, major procedures, particularly in urology, you will find that they are entirely robotic.
Right.
And rather than even open.
Right. Sir, one last question for parents. Some take-home messages, apart from these surgeries and all, some basic take-home messages that they can look after their child, that they can avoid this type of problems or not, or what are the common type of basic red flags parents should not avoid for their children to avoid the urological problems?
Sure. So I'm glad you asked the question, because that is extremely important for the parents. The first thing is urinary tract infection. In small babies, urinary tract infection, sometimes they will not have any signs at all. The child will just present with fever or will be crying without any reason. No cough, cold, nothing. Child will be crying, will be having a fever. That time, my request to the parents is, before you start any antibiotic, just take a sample of urine and have it checked. Make sure that you do a routine urine culture. Then you can give antibiotics. Most of the time, we see patients who come, especially from the northeast, from West Bengal and other places, where an antibiotic is given right away. And then you don't know whether it's a urinary infection or not. Because remember, urinary tract infection can damage the kidneys, particularly growing kidneys, within the first 3 years. Especially the first year is very important. The second thing is, all children, when they start going to school, please tell them every 2 hours they have to go to the toilet and empty their bladder. I am tired of seeing children who come and say the bathrooms in the school are very dirty, we will not pass. So I tell them nothing will happen to the bathrooms, but your kidneys will get spoiled. So it is the parents' responsibility to make sure that the children pass urine regularly. Another very good habit for parents to tell the children is to pass motion or stool in the morning before they go to school. If they don't, let us say bus comes at 7 and child gets up at 6:30. There is not enough time to go to the toilet. So throughout the day, the child has got this feeling of passing motion, is not able to eat, does not take interest in studies, and because of that is not passing urine also, and that is the stage in which they will get urinary tract infection. Then apart from that, I strongly, we are seeing too many children today who are putting on enormous amount of weight because they eat a lot of junk food. I'm telling children should have their happiness. Let them have their happiness. Let them eat junk food, but please restrict it to 1 or 2 times a week.
Right.
Constant eating out, constant buying from outside, constant eating beyond meal times, and especially in this, I will blame the grandparents. I know how Bengali families are so closely knit, how important the grandparents are to the family. They have to make sure that the child is healthy. A fat child is not a healthy child.
Yeah.
So that is something very important. And I tell parents, if the child is fat, there are 2 or 3 things that will happen. One is the child will not grow in height. The height will stop. Hypertension will be a big problem. And today we are seeing too many children with fatty livers also.
And child diabetes also, it's like epidemic.
Then they ask, how do I reduce? Because then we reach a stage where the child will not listen to you. So at a very young age, I think you have to put some habits in them, some regularity in them, and generally you will find the children will do very well. And I know, again, this is something that I'm seeing because I've been practicing in Apollo from 1991. I don't want people who see this video to mistake me. I feel somehow in West Bengal, among Bengali parents, there is this great stress on academics.
Yeah.
Like, children come from school, immediately they go for tuition, immediately they go for this, come back. I think children should have fun also. Very important. And if they can balance the two, then it will be fantastic. It will be great. They're all very bright children. They do extremely well. And there is no point in constantly criticizing the child also. Forgive me for saying this. I think you must also give them a lot of happiness. And then you will find that these children will grow up beautifully without a problem.
Thank you so much, doctor.
Thank you very much, madam.
ডাক্তারবাবুর শেষের কথাগুলো অত্যন্ত গুরুত্বপূর্ণ। একটা ছোট বাচ্চার সমস্যা, সার্জারি, এইসব একদিকে, কিন্তু একটি বাচ্চার শৈশবকে সুন্দর করে এগিয়ে নিয়ে যাওয়া, স্বাস্থ্যকর জীবনের মধ্যে তাকে রাখা যে কতটা গুরুত্বপূর্ণ, ডাক্তারবাবুর কথাতেই উঠে এলো। আর যদি এই প্রযুক্তির কথা বলি, চিকিৎসার ইতিহাসে এমন কিছু মুহূর্ত আসে যখন প্রযুক্তি শুধু অপারেশনকে সহজ করে না, ওটা পরিবারের অভিজ্ঞতাটাকেই বদলে দেয়। ডক্টর শ্রীপতিকে অনেক ধন্যবাদ এত সহজ করে, সুন্দর করে সবটা বুঝিয়ে দেওয়ার জন্য। আগামী দিনে আরো এরকম অনেক হেলথ টপের জন্য আপনারা নজরে রাখুন দ্য ওয়াল, কারণ খবর এখন এখানেই।
Thank you.